Since the coronavirus came onto the scene and changed all our lives, Dr. Anthony Fauci has become a household name. As the nation's top infectious disease doctor, no one has been in the spotlight more in the battle against COVID-19 than Fauci. And tonight, he talks one-on-one with Q2. It's been 8.5 months since the first coronavirus case was confirmed here in Montana. Since that time, more than 64,000 people have been diagnosed with the disease and 739 Montanans have died. Tonight, our Janelle Slade gets an assessment of the virus in Montana from the nation's leading expert.
With concern about the coronavirus surge, the holiday season upon us, and today, the UK, the first country to approve the Pfizer COVID-19 vaccine with distribution to start next week. We want to go straight to the top to get some perspective. So today, Dr. Anthony Fauci, the country's top infectious disease specialist, joins us here on MTN. Dr. Fauci, thank you so much for your time.
Good to be with you.
Well, let's start with developing news today and your reaction to the announcement that the UK will start distributing the vaccine next week.
Well, that's fine. They did not scrutinize the data as carefully as our own FDA is doing. They're in the process of doing that now. It is very likely that vaccine will begin to be distributed in the United States. The first batch from Pfizer likely on the 10th or 11th of December, and for Moderna around the 18th of December. So the difference is really a matter of a week and a half, not much difference at all.
Here in Montana, tighter mandates are hotly debated. In fact, many Montanans, including some Republican state legislators, recently chose not to wear their masks inside the state capitol. What do you want to say to Montanans who are making this choice?
Yeah, I don't want to accuse them or in any manner or form be pejorative to them, but I would ask them and almost plead with them to look at the data. We have 267,000 deaths and close to 14 million infections in this country. That if you have a state like Montana, which doesn't have a lot, you have Billings, which has the major medical center there. You have about 25 ICU beds in that hospital. The last time we checked, you had more ICU patients than you had IC beds for them. That's a problem.
How quickly is this actually going to turn around?
Well, the vaccine is going to be given in incremental fashion to the various people in the different priority groups. By the time you get to the normal man and woman in the street in Billings or in anywhere in Hamilton, wherever you want to be, who's a 25, 30-year-old person who's otherwise healthy, that likely will be somewhere in April where they will have open access to the trial. And then by the time you get through April, May, June, you'll have most of the people vaccinated so that you could start looking at some sort of return to normality as we get through the summer and into the fall.
And Dr. Fauci says he plans to continue in his role at the National Institute of Health, and he expects to play a role in President-elect Biden's coronavirus task force. Back to you, Russ.
All right, thank you, Janelle. And you can learn that answer, hear today's full interview on our website, ktvq.com, or with the Q2 streaming app. And come February, Dr. Fauci is slated to speak in Missoula. The University of Montana's Mike and Maureen Mansfield Foundation sponsors the annual lecture. Dr. Fauci will talk about the coronavirus, the challenges of distributing the vaccine, lessons we've learned so far, and what the new normal will look like in the future. That lecture is set for Wednesday, February 17th at noon, and it will be held via Zoom.